Allergies. It seems these days most everyone has them. In fact, 1 in 5 people suffer with allergy or asthma symptoms. So if you're like most, you're desperately seeking a solution. Florida Medical Clinic's very own Dr. Nallamshetty specializes in both pediatric and adult allergy and immunology. She's worked for many years helping people control their symptoms, and she's with us today to weigh in on your sinus troubles.
I grew up in New Jersey. I completed my medical training at Jefferson Medical College, and I completed subspecialty training in allergy and immunology at Harvard Medical School. I've been in Tampa for several years. I'm a board-certified allergist, and I care for patients of all ages, from the infants to the elderly, with a variety of medical conditions including hay fever, eczema, sinus issues, food allergies, as well as immunologic disorders.
I've heard that we're gearing up for a really tough spring season. Are allergies really going to be worse this spring?
We are seeing more and more patients diagnosed with hay fever every year. In fact, almost 24 million Americans were diagnosed last year alone. About 30% of adults in this country and 40% of children in this country suffer from at least one form of allergy, whether it's hay fever, food allergies, eczema, or another type of allergic disorder. So the question really is it, are we just perceiving that it's the worst season ever, or is it the fact that more people are being diagnosed with allergies?
What are some of the factors that increase the sensitivity of someone's allergies?
Well, there are a lot of factors that are involved, but we have seen that possibly climate change is playing a role. When the weather is warmer, we're seeing more rain. We do see that there's higher levels of pollen counts. The pollen counts are rising each year. Pollution also seems to play a role in development of allergies. We do know that more children end up in the emergency room on days when there are when there's higher levels of pollution in the air.
I've heard that pollen counts are pretty high here in Tampa Bay. Are we seeing a higher level here, and why?
Well, because of this mild winter, like I mentioned before, that kind of sets up an event with the trees in terms of things blooming earlier. We see things blooming for a lot longer, so the seasons seem to last longer. Also, we see patients, there's something called a priming effect, where they have this intense exposures to pollen and they start developing symptoms, and even as the temperatures decrease, their immune system is already primed, so even with lower levels of pollen, they're continuing to suffer from their allergy symptoms.
If someone moves from another state to Florida and all of a sudden they think they've got allergies, is that a common problem?
A lot of trees, a lot of grasses are similar in different parts of the country. If you already suffered from an allergy in another part of the country, you're already kind of sensitized to develop additional aeroallergen sensitivities when you move to another climate. Sometimes we do see a delay where you're fine for the first couple of years, and then now you're starting to develop these allergy problems.
How would one of our viewers know if they had allergies?
I think a lot of patients realize the common symptoms: the runny nose, the itchy eyes, the postnasal drainage. And yes, in fact, a lot of them may be suffering from allergies, but also it may be another problem that's going on. Perhaps they have sinus disease or something else. And that's the reason why it is very important to be seen by a board-certified allergist and be tested appropriately to really determine, is this allergies or something else that's occurring.
Doctor, describe the testing that you do to see if somebody does have an allergy.
Basically what we do is we take this plastic device, we dip it into different allergenic extracts, whether it's pollens, dust mites, molds, a variety of different what we call aeroallergens. We dip it into the extracts, and we basically place it on the patient's back. We take it off, wait 15 minutes, and you're done. You have your answers.
Dr. Nallamshetty is based both in Wesley Chapel and Tampa. You should make an appointment today before allergy season really kicks in. If you'd like more information on her or Florida Medical Clinic, go to great38.com and click on Health Matters.